Welcome back. It's great to have you with us on The Full View. Now, the Health Department has confirmed an outbreak of diphtheria at the Pollsmoor Correctional Centre in Tokai in Cape Town. This follows the death of a 19-year-old inmate more than a week ago. Diphtheria is a contagious bacterial infection which causes breathing difficulties. The department has called on the public not to panic, saying the outbreak is under control at the facility. Let's get more. We bring in Correctional Services Spokesperson Singabakho Nxumalo and National Health Department Child Specialist Dr Lesley Bamford. Let me start with you, Mr. Nxumalo. What is the situation right now at Pollsmoor Prison?
A very good afternoon and thank you for having us. I can confirm that the situation is calm and we are following all the measures that we had applied when we were facing COVID-19 and working closely with the Department of Health. They are assisting us in terms of additional measures that we need to look into, such as making a point that our officials protect themselves with relevant PPEs, the issue of deep cleaning, and also isolation of those that are considered to be direct contacts or those that may have some one may call that symptoms related to diphtheria. So as a department, it's important that we contain the disease within medium A, where we confirm that it's located, and also protect not just officials but also members of the public who often frequent our facilities. Hence, we've said the visits will be affected in an effort to contain the bacteria, not to spread to other areas or to the public.
That means no visitors allowed?
Medium A, that's where we are saying we are limiting the movement of inmates, of officials and the general public.
So is it still one fatality? How many prisoners have presented symptoms? How many are serious? And how many are being isolated?
Unfortunately, we still have that one inmate. I'm saying it's unfortunate because you wouldn't want any inmate to die in a correctional facility. We have 8 positive cases. We had other inmates who had symptoms. They were tested. Those results came back negative, but we are still waiting for some. But what we've also done is to make it a point that those that have said we consider to be direct contacts do not move to other sites within the center, and also to our officials to limit their movement as well. This also talks to even post their shift, that they do not wander around, so that in case they are positive, they do not spread the disease.
Yeah. So you're talking about the wardens. Final question, and then I'll speak to you, Doctor. But Mr. Nxumalo, so do the personnel, are they able to go home? Is there concern about that, about the workers?
They are able to go home. The staff members didn't have symptoms, but we didn't want to leave anything to chance. Hence, we said those that are considered to be direct contacts. And when the positive case was confirmed, we immediately started with that particular exercise. And we confirmed that we had 54 inmates and 15 officials as direct contacts. And those people, were able to identify them. But this also extends to those that traveled with the inmates. Remember, he moved from our hospital to an outside hospital facility and also transferred there to Grotesque. So all those, the ambulance staff, to when the inmate arrived at the hospital, it has to go through all that value chain. So as a department, we're very clear. We're saying it's important that we protect not just our staff members, but also other inmates. Hence, we've made it a call that those who may feel that they may have symptoms, no matter how light they are, they have to seek medical attention as a matter of urgency so that we're able to contain the spread of the disease.
All right, Dr. Bamford, can you tell us about diphtheria? How easily does it spread? And do these measures sound good to you?
So good afternoon, and good afternoon to the viewers. So diphtheria is caused by a bacterial infection. And we know that diphtheria used to be extremely common I think many people know it by its Afrikaans name, which is Witkiel. It used to be an extremely common disease, and now it is very uncommon because we have very effective vaccinations against diphtheria, and the vast majority of the population has been vaccinated and therefore are immune. Unfortunately, we do occasionally see cases. They can be difficult to diagnose in the early stages because the symptoms are very non-specific. Maybe some fever, some headache, sore throat. So common symptoms, but if the person does have diphtheria and is not adequately protected through vaccination, the disease can progress and result in difficulties in swallowing, difficulties in breathing, and other complications, cardiac and damage to nerves. It is a very contagious disease. It can spread very easily, but that it can be controlled. The spread can be controlled through exactly the public health measures that are now being implemented at Pollsmoor. So isolating people who are infected, identifying all the contacts, making sure that the contacts receive treatment, that they are vaccinated, and then are followed up very closely to see whether they go on to contract diphtheria.
For the general population, is there any need for concern? What if you're a parent not sure that your child received all the vaccinations? Is it time to check on this specific one?
Well, of course, we always recommend that parents and caregivers make sure that their children are fully vaccinated. The diphtheria vaccine, we give a number of doses. Children receive doses of diphtheria vaccine at 6, 10, and 14 weeks, and then booster doses at 18 months and 6 years and 12 years. And we have also been providing doses in our schools linked to the HPV vaccination campaign. But we always recommend that parents make sure that their children are fully vaccinated, and if they have missed doses, to take them to one of our health facilities. We do provide catch-up doses to make sure that our children are fully protected.
All right, Mr. Nxumalo, just to enforce what you were saying, am I correct to say this is fully contained right now at Pollsmoor Prison? You did say some of the personnel had moved with the prisoners, but no other confirmed cases in any other correctional service facilities. Is that correct?
Yes, for now it is only located at Pollsmoor, medium A. Hence the preventive measures that we've put in place, because we will want to contain it there, dilute it there, and we know that we're done. And even the new admissions, we're not taking them to the section where the index case was identified. Also, I've spoken about the movement of officials, inmates, and all other people. So it is very important that that containment is there, so that once we've deep cleaned, done everything, and everyone receiving a clean bill of health, then we will know that we've dealt with it and we're done. But this is a disease, hence we are saying let us leave nothing to chance. Let us also make it a point that even other sites, other facilities, we do ring that call again to say protect yourself at all times. Make it a point that even those around you are also protected, and the word of vaccination, because there is a vaccine that's available, especially for those who are never vaccinated for diphtheria. It's important that they do take a vaccine, especially those that we consider to be of high risk. That's the category which is really vulnerable. So as a department, we're working closely with health in making a point that whatever measures that we put in place are measures that are guaranteed to work, but also where the diseases find gaps there and there, we're able to also close doors as a matter of urgency.
All right, thank you to you both for your time. That was Correctional Services Spokesperson Singabakho Nxumalo and National Health Department Child Health Specialist Dr Lesley Bamford.